Hello everyone. This week we are going to cover determinants of health and then also mental health. So really this first half of this lecture is going to be about, do people choose their own health? And in public health, this is an important question to address because there are so many factors that people don't control that have vast amounts of impact on our health. Where we live is probably one of the most important things to our health. Our community, the environment we live in, crime, education, all these things. So we're going to go through that, and then we'll cover some of the mental health issues that are, becoming more common today. So let's jump into this. So again, we're going back to the leading causes of death. We've talked about this before. In the past, there was a lot more infectious diseases, and now it's mainly the chronic diseases. And for these chronic diseases, a lot of factors play into who develops, heart disease, cancer, um, you know, and we're going to talk about this a little more, why certain groups are more likely to develop these. Just again, just to note, since that last chart doesn't really account for the recent opioid epidemic, and you read the paper on this, just be aware that this is another big cause of death that is going to be around for a while. Also, just to show some of the changes over the last couple of years, unintentional injuries, Alzheimer's, and suicides went up a little bit. So in unintentional injuries, that can include the overdose deaths in there. So again, going back to the leading causes of death, what is actually leading to these conditions? And again, we've talked about this: tobacco, number one; poor diet, physical inactivity, number two; alcohol consumption, three; and then down from there. So these are kind of the behaviors or environmental factors or etc. that we really want to change on the right. We want people to smoke less, eat better, exercise more, drink less alcohol, don't drink and drive, then don't have risky sex to get infected with certain diseases. Then we have to clean up our environment, and down the list. So if you look on the right, those are kind of key areas public health is targeting, and we'll continue to try to reduce the impact over time. So again, the actual causes of death, like we just talked about, most are preventable. If you can get someone to stop smoking, and then, lots of these people, eventually they will maybe develop heart disease, but they're developing it earlier because they smoke, they eat bad, they don't exercise. So again, this goes back to individual behaviors that they're modifiable, so they can be targets for public health interventions, but really over the last 30 years, besides smoking, we have reduced smoking rates a lot. People are still smoking, of course, but we have had a big impact in lowering the rates. But for diet and exercise, we really haven't had any substantial impact yet, so we're still working on identifying ways. With like safe sex, I think we have been doing a bit better, but obviously we need to do more in that area as well. So again, these are preventable. That's the big point, and that's why they're a main topic in public health. So just going over tobacco, I know we've lectured on this. It increases your risk for cancer, cardiovascular disease, lung diseases, and infant deaths if you smoke while you're pregnant, and burns, fires in people's houses, things like that. Again, poor diet and physical inactivity. So obviously obesity and diabetes are two big ones, heart disease and stroke. And then, really this is linked to a lot of cancers. Um, so those are important to address too. Next is misuse of alcohol. So and this really focuses on, younger people, college-age people, because a lot of times they're more likely to be in the car crashes. And then over time, if you keep drinking, this is when older people are chronic liver disease and cirrhosis. And then there's obviously it impairs your judgment. It leads to all these other injuries, drownings, fires, all sorts of problems. And then it's also a big factor in a lot of cancers. So while there's a lot of research out there showing some benefits of alcohol use, obviously if you drink too much alcohol, it's not beneficial to your health at all. And in public health, we really need to be pushing the balance, the moderation, which is, usually the big issue with alcohol use. And it's hard, it's portrayed in movies as like super fun to drink alcohol. It's part of our culture. So there's a lot of work to do in this area, as well as the other preventable behaviors. So while infectious diseases have dramatically reduced, this is still a major concern for a couple of reasons. One is because of emergence of new diseases. So, HIV is a new disease, and it took a long time to figure out a way to treat it, but we still can't cure it. And there's lots of other diseases that, you just have to live with. You can't really treat or cure. And then antibiotic resistance for a lot of infectious diseases, MRSA, certain types of pneumonia. There's a big fear from the World Health Organization. They list this as one of the main concerns is antibiotic resistance. And I just was at APHA's conference, and they had a speaker from Doctors Without Borders, and she was talking about she sees a lot of antibiotic resistant infections killing, I think she said over 700,000 people around the world. And they don't have ways to test to identify the best way to treat these infections around the world. They can't be like, they kind of just have to guess which antibiotic to use, which is problematic because you can use the wrong one and then you're leading to more resistance. So it's still a major concern and something public health needs to be aware of. Also, there's a big fear of like the famous Spanish flu in 1918, killed millions of people. So there's a big fear of pandemic flu, things like that. So while we have kind of shifted public health, the main focus to the chronic diseases, these infectious diseases are still very important to address and be aware of. So toxic agents. So there's lots of chemicals and things in our environment that can cause adverse health outcomes. So you watched the video about the lead pipes leaching into the water in Flint, Michigan when they changed their water source and it was too acidic. So that's just one example of a toxic agent that had, for children especially, has neurological and, poor outcomes in their IQ and et cetera, stuff like that. But then with climate change and all the air pollution, our growing population, more cars, more energy created, air pollution is a huge issue. And then just down the list from there, there's tons of pesticides, things we use, we use them for certain reasons, but they can be harmful to our health, especially if larger quantities. So this is a huge thing that's often overlooked, but we still need to continue pursuing ways to make our environment cleaner, remove some of these toxic agents, you know, just depending on who your target population is. So when we're looking at these modifiable behaviors and, some other things such as environmental impacts and exposure to toxic materials, like public health is always trying to identify what type of intervention should we be using. Should we just educate people? Education is key and it's important, but it can only go so far. We've been educating people for 30, 40 years about the harm of cigarette smoking, but some people still choose to smoke. So then regulation, should we put in laws, taxes, regulate what people can eat, how much fat can be in food. So regulation is a big tool that can be very useful, and policies often have the biggest impact. So you think about smoking. Smoking is always the best example to use because there's so many good examples. So when we increase cigarette taxes, people smoke less. When we ban smoking from, lots of public places, airplanes, restaurants, people smoke less because, it's less socially acceptable. We shift the social norms. We make it a little bit harder for them to smoke. You have to go outside. You can't smoke at work, etc. So those policies have really big impacts. So regulation is a huge tool. And then the third is prohibition, which, over time, we've tried this a few times through, alcohol back in the United States when they made alcohol illegal. Obviously, it didn't work. We've tried this with a lot of drugs, and we had a whole war on drugs, and it didn't really work. People still use drugs, and it really has led to a lot of the violence in Mexico and other places. So prohibition, the idea sounds good. Let's just outlaw McDonald's. The problem is it's not really getting people to change their behaviors on their own, and it just leads to a lot of unintended consequences. So, potentially it could be good for certain things, but it's kind of a tricky way to approach public health issues. So let's jump into education. So when you educate people, they're more informed, they become more aware, and you can think of a lot of examples how we've been improving this. We have nutrition labels now. We're trying to put up more calorie counts in restaurants. So you're educating people, giving them the choice to make an educated decision. Before, if people had no idea how many calories were in a meal, they would just have to guess. And they've done lots of quizzes, even with the nutritionists. They'll have them compare 3 meals and be like, which one has the most calories? And no one, especially the general public, they cannot identify which one has the most calories and which is like the worst meal for you. So obviously we need to give people the information, and whether they use it or not, it's kind of up to them. But some super effective education programs are sex education in schools. So a lot of these states that do comprehensive sex education show far lower rates of STIs and teenage pregnancies than other states that don't. So, it has to be combined with access to contraception and other services. But that has shown to have a big impact. Um, so if you talk to your doctors and your doctor is recommending certain things, that has been effective to get people. If your doctor recommends you get a flu shot, and really talks to you about it, or talks to you about getting your child vaccinated for HPV, then you're more likely to get that vaccination for your child, um, in place of just having general education like a flyer. If the doctor actually talks to someone, it helps a lot. So we use a lot of advertising, um, commercials, the Truth Campaign for smoking, and then again, going back to smoking, changing the social norms. So let's look at alcohol, for example, for 1 minute. Um, in media, in movies, and everything, alcohol use is kind of portrayed as this is fun. You're supposed to go to college, get wild, get drunk every night. You're supposed to drink, 10 beers. Um, so our social norms around alcohol use are kind of, this is a celebration, it's fun. We don't really focus on some of the negative things, increase your risk for sexual assault, increase your risk for injuries, all types of injuries, car crashes, and then the long-term impacts on your liver and your, cancer risk. So we've done a good job with smoking, but with alcohol, we still need to kind of do more work to change what people perceive, what the norms are around drinking. So next, regulation. So regulation is a very important tool, especially when you're trying to keep one person from impacting the health of others, is kind of the guideline. So, you think about stopping people from smoking inside because you're exposing other people to um, tobacco smoke. So there's tons of laws, that we've passed. Traffic regulations make people drive safer. Lots of states have passed, laws against texting and driving using your cell phone. Um, and there's tons of other ones. Laws requiring vaccination for schools. Of course, there's a lot of ways to get around that, but so these regulations do work, and they are often the most effective way to change behaviors, but obviously they're not perfect. So you think about any like private behavior, sexual behavior is a hard one to regulate. Um, you know, the, the the best way to do this is to require annual STD screenings, STI. So the idea is to diagnose and treat people as soon as possible so they can't infect other people. So, some people have suggested we do premarital screening for STDs, but obviously that's contentious because, you could be exposing a person's behaviors, and there's not a big, huge push for that. So there's some behaviors that are very hard to put regulations in. But it's always good to try to think about these policies because they are oftentimes the most powerful tool we have in public health. So now we go back to prohibition. So when we did outlaw alcohol, we did reduce diseases caused by alcohol. And then prohibition against heroin, marijuana, and cocaine, people, the the general public, was supportive of this. But again, just thinking about how much this has cost, and um, all the cartels in Mexico making millions of dollars off illegal drugs, and then all the violence in Mexico and other countries. So, and then the last thing is here, I was at APHA, they did a big session on criminal justice reform, and you're going to read a paper about adverse childhood experiences this week, and when you're sending someone's parent to prison for selling marijuana, um, that has a huge impact or a potential impact on that family, and you're kind of setting them up, making it a lot harder for them to succeed and be healthy. So there's all kinds of issues. Again, even with the prohibition on alcohol, this is where Al Capone and all these other gangsters made tons of money off of illegal alcohol. So there's all kinds of issues that can come up with prohibition. So now we're going to jump into determinants of health, which are very important to discuss. What are all the factors that are impacting the health of people? And we've talked about some of these. So your personal features, your biology, are you man, woman, age, and your genetics, which you can't really change. Your behaviors, which we've talked about a lot, smoking, drinking, exercising. Your physical environment, where you live, are you exposed to air pollution, lead, your social environment, you know, is there a lot of crime around you? What do people do? Do people work? Do people read? Is there violence in your house? Is there violence in your neighborhood? Are you neglected? Stuff like that. Access to health care. And then all the policies, states with strong social net, offer more support compared to other states. So depending on where you live, there's lots of policies. But we're just going to really talk about these social determinants of health in this because we've talked a lot about the other factors. Again, we've been over this. Your biological and genetic factors, your age, sex, genetics, these can predispose you to certain diseases. So it's important to note, but you can't really change these. It's just important to be aware of. Again, individual behaviors, we've talked about this, but it's important to note that just because people who smoke, that choice is impacted by lots of other things. How many smoking advertisements are you exposed to? Do the people around you smoke? Do your friends think it's cool? There's all these other factors. It's not just, an easy, I should choose to smoke or not smoke. There's lots of things that go into that, and all our other behaviors. So again, physical environment is huge because we're exposed, depending on where we live, we can be exposed to a lot of carcinogens or other air pollution, all types of things. So in Louisiana, there's a place called Cancer Alley along the Mississippi River where there's tons of oil refining factories. So they're doing a lot of these super intense chemical processes to make gasoline and things like that. And the people that live really close to these areas are, often low income and African American, and they have super high rates of cancer. One, because of the exposure to all these chemicals, just because of the proximity, and then two, their neighborhoods, their lifestyle. So it's all this stuff. Then again, safety at home. Is your neighborhood have lots of crime? Is it nice? Parks, things like that. Do you have transportation? How's your housing? Do you live in an old house? It's all moldy, cockroaches. All those things can greatly increase your risk for asthma. The lead in your water, like you saw from the Flint, Michigan video. And just violence from your parents, just from your people in your neighborhood. So these are all huge factors. Do you have, can you walk to school, sidewalks? All these things often get overlooked because they're not easy to change, and lots of people don't really think about how all this stuff impacts your health. So here's just an example of a facilitator. I live in a nice neighborhood. I have a walking path and a bike path. So, it's a lot easier for me to go exercise, ride my bike to work, all those types of things. If I lived on the right and I was trying to ride my bike to work, or even walk to work, I'd be pretty worried because it doesn't look very safe. So you can see how where you live can impact a lot of behaviors. So the healthcare system, access to high quality healthcare is important, and there's a lot of other factors in the outcome of your care. Is it affordable? Is it culturally appropriate? Language barriers? Is it easy for you to get referrals to other services? Obviously, do you have insurance? So the Medicaid expansion, depending on the state you live in, South Dakota didn't expand, can have a big impact on whether or not you go see a doctor in addition to all these other factors. So when we do get sick or we want preventative care, we need to have access to this. And it's often, for the lower income minorities around the United States, they're less likely to access these services. So here's just some graphs showing some disparities in insurance and healthcare. So if you're a low-income family or a moderate or a high-income family, obviously if you're low income, you're more likely to be uninsured, at least, occasionally. And then on the right, the access. So lots of people try to look at why people are going to the emergency room for non-emergency reasons. So, and the biggest thing is people, they run out of their medications. So they probably needed a refill, they needed to see their doctor, or they didn't have money to pay for their medication, so they end up going to the emergency room. So if we could just help these people get their medications, we would save the healthcare, we'd save thousands of dollars in healthcare costs per patient. So, and then the other thing is not having affordable options, so they can pay to go to the doctor, or they don't even have a regular doctor. So access to care is still a big issue, and it ends up costing a lot more money because lots of people eventually do just go to the emergency room. So now let's jump into social determinants of health. So really, these are all those forces beyond an individual's control that affects their health status. So we're not looking at your biological or even health services. And overall, these have huge impacts on your life expectancy and risk factors for other diseases. So if you look at this little chart at the bottom, you can see some of the living and working conditions, unemployment, water, housing, and we're going to go through some of these. Education. These are all huge factors on health. So the WHO, they have 10 key categories for social determinants of health. So first is your social status, kind of like what's your position in society? Are you, a working, blue collar, working class person? Like, how do you view yourself? Are you, depending on what you feel your position is, it has a big impact on your health and how other people treat you as well. So, a doctor, is high, they're respected, then like if you work at McDonald's, people probably don't respect you even though you're working hard. You just put in kind of a class in society. And they've done huge studies on how stressed people are, and the higher you are in your work life or company, lots of people assume the higher up you get, the more stressed you would be, but the higher you get, the actual less stress you end up having. So social status is a big one. Social support or alienation. So this comes down to like racism, discrimination. Right now in the country, we have a lot of anti-immigrant rhetoric in politics and etc. So imagine being an immigrant living in this country. Let's say you're from a Muslim country with all the, wars and stuff that's been going on in the United States. This is going to put added stress and, just a lot of pressure on those people. In reality, they're probably just here trying to make a better life for themselves and their children. So it may be harder for them to be included in their community depending on where they live. And those all, if you lack that social support in your community, it's really has a negative impact on your health. Food, people don't really think about this as an issue in the United States, but people assume we have so much food, we're eating all the time, that's why we're so obese, but obesity is pretty complex. And a lot of low-income people actually are insecure. They often run out of food. And then, access to healthy food is a big issue. So when we do have food, often the lower income people are eating the wrong types of food. And we've talked kind of about food deserts and stuff like that. Housing is a huge issue. So where you live, how is it high quality housing? What other, do lots of people smoke in your building? Is it a smoke-free building? How much does it cost you is a huge factor, because if you're spending, 70% of your income on your housing costs, it doesn't leave much for food, medical care, anything else. So those are huge factors. Education, especially early childhood education. What is the education system like? So, oftentimes the education system in the lowest income neighborhoods is the poorest, and we don't pay our teachers. There's no incentive for, you just have to be a really motivated, passionate teacher to go work in these neighborhoods for very low income. So it's hard to get a huge population of really good teachers, and the issues just go from there. And you probably read a little bit about this in the journal article for this week. Work, being employed is one of the best things for your health, because obviously having an income, it also makes you feel valued in society depending on where you work. But then you have to think about, what type of work are you doing? Is it dangerous? Is it hard on your body, etc.? All those can impact your health. So stress is a huge one. And, lower income people, lower status people, racism, discrimination, all these factors can increase people's stress a lot, which has huge impacts on people's health. Transportation. So if I don't have a car, how am I going to get to my doctor's appointment? How am I going to take my kids to school, to soccer? It's a huge issue. The way the United States was built, it was around the car. So if you don't have a reliable method of transportation in most cities around the country, it's pretty difficult to use public transportation. It takes a long time. With Uber and Lyft, this has helped a little bit, but that costs a lot of money. So transportation is a huge issue. And then place, so where you live really does impact your health. If you live in a rural place, you may have less pollution, less crime, but you probably have less access to healthcare, less access to economic opportunities. So just depending on you live. And then our built environment, I don't know if you've learned a lot about this, is just how we build our cities and our homes and everything. So, if we build our homes with parks and walking paths and bikes paths and good public transportation and, solar panels, and we're removing pollution, you can set up your environment to be very healthy. Or, you can live in a super old building that's has all kinds of problems, leaks, mold, not good ventilation. When you cook inside, your indoor air quality is horrible. All these things going on, no parks, no sidewalks. So if you live somewhere like that, it's going to have a huge impact on your health. And then last, we're not really going to get into it, but it's access to health services. And we talked about this a bit. And I just put another one on here is addiction. So with the opioid thing, we really have to shift our, social norms to treat addiction as a disease and not as a crime anymore. There's a lot of stigma that stops people from getting care. So those are the key categories.